this QR code. There we go, we've got the recording going. You can use this QR code, yes, for our evaluation link and use that link that's posted in the chat. Our learner objectives today include reviewing the Indigenous HIV/AIDS Syndemic Strategy, or Indigi-HAS, from an urban Indian perspective, identifying various ways to apply the strategy based on UIO facility type, and discussing the particular needs of attending UIOs and guide you all through the solutions using this strategy. And wanted to take a moment to draw your attention to why we chose this particular time of year for this event. We're reaching the end of Native American Heritage Month, a time to honor and celebrate the rich cultures, histories, and contributions of Native American and Indigenous communities. And December 1st, at the end of this week, marks the 35th World AIDS Day, a day to raise awareness of the continued efforts to end the HIV epidemic globally. So with both of these events on our minds, this is the perfect time to celebrate our collective efforts to end the HIV epidemic in AIAN communities and take the next steps forward together. Thought that was a pretty wonderful timing. So now we're going to get into the bulk of things. I'm going to start with an overview of the Indigenous HIV/AIDS Syndemic Strategy, weaving together the national HIV, STI, and viral hepatitis plans, which I'll refer to as Indigi-HAS, just a little bit easier, a little bit quicker to roll off the tongue. A link to the guide itself in PDF form will be placed into the chat. So I really encourage you to open it up, have it open yourself, and follow along. Feel free to explore and find what's most interesting to you. And again, ask questions as we go. We'll start with this overview, and then we'll get into some of the more direct application. So I'm going to go ahead and stop sharing these slides, and I'll take just a moment to get the guide up so that I can show it to you all. And here we are. All right, we are within the Indigi-HAS guide. This is a fairly long document, so I'm going to just take 10-15 minutes to talk through the primary points of focus throughout and get a sense of what all is contained here, why this guide exists, who it's for, all of that wonderful stuff. As we get into it, it will become apparent that there's a lot of information contained here, a lot of different directions that you could use this guide within your own work. And that's exactly what it's for you to apply in the way that makes sense within your context. No one is expected to apply every single strategy here, go for every single goal that's laid out. It really is a framework that's meant to be individualized within the contexts of any organization using it. So we're talking today from the perspective of urban Indian organizations. This guide is intended for anyone in the ITU system, for IHS, for tribal organizations, and for urban organizations. So you'll see some language throughout that refers to different contexts where this guide might be used, and all of them are completely valid here. So we can start just going right through the guide. I want to highlight the vision of the creators to start. We envision a world in which all Indigenous people are healthy in mind, body, and spirit. The spread of HIV, STIs, and viral hepatitis is prevented. Every person knows their status and lives free from stigma and discrimination. And every person has access to high quality, holistic care that reflects Indigenous values, promoting relationships with each other, the land, and all beings. This vision includes all Indigenous people, regardless of age, sex, gender identity, sexual orientation, religion, disability, geographic location, socioeconomic circumstance, or health status. That's the overarching vision that the folks that created this guide are starting from, and I think it's really fantastic to kind of ground ourselves there to start. This is a fantastic list of all of the folks included in the advisory committee who put this guide together. Maybe these are some folks in your own network. They come from a lot of different areas, a lot of different cultural backgrounds within Indigenous communities, and have come together to really collaborate to put this guide together. So I really want to give credit to these folks. And as I'm going through this beginning piece, I'm just going to click through some slides that have some fantastic background information that I encourage you to look at on your own time. It's great to dig into, and I want to prioritize today's time on some of those practical applications. So as we get to the table of contents, there's a few key pieces I'd like to point out. We're going to start with the executive summary, which will give us some of that foundational background information. Again, I'll go pretty quickly through some of the context here. There's a few key points I'd like to highlight, and I also really encourage you to dig in yourself and see exactly what the creators of this document were really thinking and putting into it. Then the majority of this guide is really focused on those main messages, goals, objectives, strategies, and progress measures. That's the bulk here, pages 34 to 100. So it's a lot of content. So I'll get us familiar with kind of the structure of those sections, what's contained within, and how you might start to apply it. Then I do also want to highlight at the end there some of the promising programs and practices that are included, and the indicator tables at the end. So I'll skim through a few things. Again, if you'd like to stop and ask questions and want a little bit more depth on any of the things that I'm glossing over today, very happy to do that. And you all have a link to the guide now, so I would very much encourage you to do a little exploration on your own, even while I'm talking. Just go for it. I do want to stop here for a second with our executive summary to talk about this context. It's really reaffirming that vision laid out at the beginning, that we're looking at conceptualizations of wellness, focusing on promoting a holistic approach that emphasizes balance between the spirit, mind, emotions, body, and relationships with land, community, and all creation. This way of being requires an integrated strategy to address conditions such as HIV, STIs, and viral hepatitis. So there's this really strong values-based background going into this document and this strategy. And this kind of lays out the big picture structure that we're going to get into in just a little bit. Again, there's a lot contained here. 8 main messages, 14 goals, 23 objectives, 66 strategies, and 14 programs and practices. Ooh, again, a lot of what we're going to talk about today is how to kind of narrow down your area of focus, find the messages that are most applicable to your work, find the goals that are going to help structure the strategies that you want to put in place, and know that all of this is here to help serve you. You are by no means obligated to go through every single piece. And to further highlight the main messages, these are those big picture categories that we're going to delve into a little bit more. We've got sovereignty, partnerships, availability, and capacity. I believe on the table of contents, this is that clinical resources piece as well. Cultural responsiveness, awareness and stigma, and data systems. So these stood out to the folks who made this document as the primary areas for improved HIV, STI, and viral hepatitis care that they really wanted to provide some strategies for. We've got some excellent quotes. I'm going to skim past most of the wonderful quotes that folks have added to this document. And yeah, really emphasize going back to see those because they really add a lot of depth to the document itself. I wanted to pause here to really emphasize the contextual framework that they're using. It's even in the title there, a syndemic strategy. If that's not a term that you're familiar with, we've got a great definition over on the left there. So in using a syndemic approach departs from the Western biomedical approach to diseases to diagnostically isolate, study, and treat diseases as distinct and separate from other diseases and independent of social contexts. Instead, within a syndemic framework, interactions and the social, environmental, or economic factors that promote such interaction and worsen disease, that's really what we're looking at, is that holistic big picture approach. So especially if you've been working in the HIV field for a while, you know that if you try to separate out STI care, you try to push, viral hepatitis into a different silo, that doesn't really work. These are all interconnected, very specifically, even down to the biomedical level. If you have an STI, you might be more susceptible to HIV infection. And this goes another level out. We've got things like behavioral health, mental health, substance use are all part of that syndemic approach. And it goes even further than that. Housing, food, shelter, connection to community and culture. A syndemic approach really emphasizes how interconnected all of these pieces are and pushes back on the narrative that we should be siloing them off and have specialties in each individual area, saying we've got to look at. And that's where this context on the right about bringing in an Indigenous holistic approach to health and wellness is really the foundation of that syndemic idea. So really situating an individual within context of relationships to family, to community and the environment, and bringing in elements of emotional and spiritual health along with physical and mental health. So that's really where we get this Indigenous HIV/AIDS syndemic strategy. I had the fortunate experience of being able to speak with some of the leaders behind this project at a conference earlier this year. And they were really talking about how they didn't want to take an existing strategy and indigenize it, like kind of gloss over something that's already existed. They wanted to create from the ground up something that really had this foundation of these Indigenous approaches. Syndemic approach. So it's not indigenized, it's indigenous from the ground up. And I thought that was a really touching moment to be able to hear them explain it in that way. And moving right along, there's a lot of great background information on their development here. And did want to point out that the concept of the medicine wheel is really underlying all of this document. They incorporate traditional medicines throughout. They highlight them section by section as this real connection to the traditional medicines that are so fundamentally important to Indigenous communities, and really acknowledging the role that culture and ways of knowing are really weaved throughout medical care in any sense here. And the core values that this document is based upon. Again, encourage you to kind of read through all the specifics here, but I love that this is a kind of non-hierarchical, very, very broad and very loving approach to this work. There's, love and respect, affirming community strength, honest trust and trustworthiness. There's a lot of really phenomenal key values that were identified by the folks who created this as common across Indigenous communities. So that really serves as a foundation for this document. Again, a little bit more background on health systems and the importance of this document. And we're back to just a reminder of the big picture structure we're about to get into. So again, those 8 main messages, 14 goals, 23 objectives, 66 strategies, and 14 programs and practices. So we'll see in just a minute how that's organized so we can get through each of those components. Another key part of how this document is organized is by type of intervention and level of intervention. So if you're familiar with some of the other ending the HIV epidemic frameworks and strategies, they talk about these 4 pillars of prevention, treatment, diagnosis, and outbreak response. And that's really how a lot of the different specific strategies and specific goals are categorized. So you'll see these little icons down in the corner on each individual page. And that'll give you a sense of, okay, are we talking prevention? Is this specifically about treatment and diagnosis? What about response? It'll kind of key you into which level or which type of intervention you're looking at. And then for the level, we're looking more at, is this for an individual or a family, a community, or the whole healthcare system that we're talking about, maybe a whole clinic. So each page will have these on them with little reminders of what each one means, so that you can get a sense. If you're really particularly looking for those individual and family interventions, you can find them. If you're more concerned about the system, you can find those and everything in between. A lot of them apply to multiple different types and multiple different levels, so that's all included. And now we're into the bulk of the document that's going through these 6 key categories with our messages, our goals, our objectives, our strategies, and our progress measures. So I'm going to use sovereignty as our example to walk through each of those individual pieces, and then get to the last few components of the guide, and then we can start working through how could I actually apply this in. So beginning with sovereignty, again, we've got some really phenomenal quotes at the beginning, grounding why this is such a key message for this guide to use. And once we dig into this section, we'll see that each page starts with a main message that's then going to include goals, objectives, and strategies that are all related. The way that I've been thinking about this document as I go through is if you're kind of looking for something to spark your interest or to get you started, it's easiest to start with kind of the highest level. So maybe that main message. So if you read that main message, does that sound like something you want to work on? And if so, then you could dig into the goals. If that goal feels familiar and like something you want to strive towards, go for the objectives, and so on and so forth. It can feel really overwhelming to want to read every message, every goal, every objective, and every strategy. If you have the time and patience for that, I highly encourage it. And if you're looking for a little bit more of a targeted approach, start at the top and go down as you get a little more familiar. So we start with the main message of centering Indigenous sovereignty in the design and delivery of all health services, including sexual health services. So that's a main message. It's a little intangible. That's kind of hard to implement, step by step, and to know what to do with. And that's where we get to our goals, objectives, and strategies to really break it into those tangible pieces so you have a place to start. So a goal under this main message would be to increase understanding, recognition, and respect related to Indigenous sovereignty. All right, great. We're getting a little more specific there. Then it's broken down into an objective. We have objective 1.1, which is talking about educating public and private partners, including federal, state, and local agencies, about Indigenous sovereignty and how sovereignty must be considered in building relationships and working with Indigenous communities. Great. Okay, we're talking about some specifics. We know what that education could look like. And maybe you want a little bit more specific. That's where we get to our strategies. Building relationships between Indigenous communities and public and private partners. Increasing recognition that body sovereignty is an extension of Indigenous sovereignty. And that's kind of the format the whole guide is going to take from here. Starts with the main message, broken down into one or multiple goals, broken down into one or multiple objectives, broken down into one or multiple strategies. So we can see it continues. Oh, and again, that bottom right corner I want to highlight, we've got this is at the prevention and response type and the system level. So it's kind of a good key and example. As we continue through, so we have the same main message reflected here, and we have another goal with another objective and a bunch of strategies. Don't want to read through every single piece just to keep us moving, but you can see how this is sort of broken up piece by piece throughout. So maybe you would read that first goal and say, that's not quite in line with what I want to do. Let's see what the next one says. Come here to goal 2, talking about increasing health programming both within and outside of Indigenous communities that is grounded in principles of Indigenous sovereignty. Maybe that strikes a little closer to home, and now you can go into these objectives and strategies. Again, quotes embedded throughout, really, really important contextual piece for why this work is so important. And then finally, at the end of this section, we're going to have our progress measures, our indicators here. So these will apply to a lot of the individual pieces of the goals, objectives, and strategies. And we've got this note over on the left. This is noted for every single one, that some of these indicators are composite measures. They're going to incorporate pieces from a lot of different elements. And that's where we'll get to our indicator tables at the end, which I'll break down when we get there. So for this example, we have indicators 1.1 and 2.1. Some might have more, some might have less, looking to measure an increase in sustainable federal and state funds dispersed directly to Indigenous communities and organizations. And number 2 there, increase understanding of inherent Indigenous rights among community members and public and private partners. So those are some measurable elements that you could use if you're trying to implement some of these strategies and saying, I would really like to see where we're making progress. I'd really like to see some tangible indicators, quite literally, of what we've been able to accomplish with all of our work. And this is to help guide that sort of evaluation process so that you can really see the change as you move forward. That's one whole section broken down. I'm going to click quickly through the others, but not do quite as deep of a dive. We'll get to that as we have some examples to work with. But just to see, we move on to the next section, cultural responsiveness. It's going to be broken down very similarly. They're all color-coded and have a different traditional medicine, traditional element associated with them. So as you get familiar with the guide, it's easier to kind of key into what each individual section looks like so you know where to find what you're looking for. So once again, we start with some quotes that ground us. We've got a main message, we've got a goal, and we've got objectives and strategies for that goal. So we already see that this one has a few more objectives, a few more strategies than the last. And in the bottom right, again, we've got the treatment, diagnosis, response piece, and these are more community level interventions. We've got another goal, more objectives and strategies, and on we go. Indicators again at the end, a few more for this one. We move on to partnerships, very similar structure going throughout. And I don't mean to breeze through too quickly. We will dig into the meat as we go. We move on to awareness and stigma. And once again, this is looking pretty similar going through. I want to pause quickly here just to acknowledge that clinical resources and services is probably the largest individual section here. It's probably the one that's most salient to most people. We really want to improve our clinical resources. We want more people getting tested. We want lower HIV rates in our communities. What can we do about that? So there's quite a few very specific strategies throughout this piece. We've got, goals, objectives, and strategies all the way through. This one is quite a bit larger than some of the others. And again, it's all organized so that you can hopefully go through and look at the goals themselves and see which one is most applicable for me, and then go into some more of those details. Really goes on. And then some indicators again. Finally, we've got data systems. This is number 6 of those main categories. And once again, goals, objectives, strategies, all the way down with some great indicators. Then we move on to a section after those 6 main categories. We've got some promising programs and practices. This is going to be laid out a little differently, but this is to give you some real world examples of folks who are doing this work and what it might look like contextualized within someone's particular organization. It can sometimes be difficult to imagine from these sort of broad, big picture, very decontextualized examples of a strategy, what it might look like. So that's why these promising programs are included. Again, we've got the same sort of levels and types indicated, and they're broken down by category. So we have some clinical promising programs. These are all active links you can click out to see what these organizations are doing with their clinical programming. We've got capacity development. Once again, can click out and see what exactly is going on here. Can we replicate some of what's going on? Can we learn some lessons from what this organization has done? We've got advocacy, and then finally we've got youth programs. So this is a great place to come back to if you see one of these that really sparks your interest and you say, I think we could do that. This is a great place to go to see what exactly has gone into their programming. Even a great place to start some networking and reach out to some folks. This section is really highlighting how grounded in the existing strategies this strategy is. Again, it's not meant to be this indigenized overlay over existing things, and it's not meant to fully replace them or anything like that either. It's supposed to be used in conjunction with the National HIV Strategic Plan, the STI National Strategic Plan. So this really lays out how each of the individual categories and those main messages really ties in to what these other strategic plans are saying. So it's really grounded in this evidence and creates this beautiful alignment with what we're trying to do just across the country. Some acronyms for folks that may not be familiar, that's great to dig into. If anything in the guide pops up that you're not quite sure what it's referring to, this is here at the end. And finally, this is the last piece I really want to highlight, is these indicator tables. So when we saw those progress measures, those indicators, it was always linking back to these tables. There's a lot more depth of detail here. So you see that each indicator is broken into sub-indicators when applicable, and there are some data sources related to it. So this can give you even more of a foundation for that program evaluation piece, for that guiding of, are we accomplishing our goals? Are we making, measurable changes in the areas that we're looking at? And this is again broken down by those 6 categories, 1, 2, 3, 4, 5, and there's quite a few for clinical again, and 6. That's all housed at the end. And again, they're linked between sections. So you can always click down and see what's going on there. And finally, there's a ton of resources. This is all very well researched and very well put together. I also think it's a beautiful piece of work. So I love seeing just all of the work that went in here. And that's the end of the document. I'm going to take us back to the table of contents so we can breathe for just a moment, because I went through quite a lot of information there, just so we can see, again, the big picture structure that we're looking at. We've got that excellent context at the beginning, a lot of background information, a lot of grounding. We've got our 6 main categories with our messages, goals, objectives, strategies, and progress measures. We've got some promising programs and practices, and then at the end there, those indicator tables. Lots of information to take in. That is a big picture overview. I know the first time that I saw this document, I was a little bit overwhelmed, like, oh, I don't even know if I would know where to start here. So that's kind of what we want to get into next. But I want to pause for a moment, having just given this big picture overview. If there, excuse me, are any questions or comments or any part of the guide that you'd like to look at a little closer before we get into some examples. I'll pause for a moment. All right, seems like we don't have any questions at the moment. So I'm going to quickly take us back to the slides so we can start talking through some kind of case study examples. So these are real world examples that we've gotten from UIOs that we work with, maybe multiple for some of them. So some common concerns that come up. And we've got these kind of delineated by oh, there's a request in the chat for where to find the guide. If we could share that link again, we did share it at the beginning. We want everyone to have access. So again, please feel free to follow along on your own. As I was saying, yes, we're going to go through some case studies and they are delineated by facility type. The concerns in them may still resonate regardless of facility type, but just for some context on what we're looking at. So we're going to start with this first case study. We'll sit here for a minute. We can think through this together, and then I'm going to go right back to the guide, and together we can kind of scroll through and find places that maybe someone who is having this particular concern might start. So UIOA is an outreach and referrals organization. Community members come to this UIO for traditional medicines and cultural practices, as well as referrals and recommendations to local clinics. Recently, a community member brought a concern to UIO staff about racist comments and cultural insensitivity they experienced at a clinic they were referred to. The UIO leadership is looking for ways to ensure they are referring community members to clinics that will treat them with respect. They want to build strong relationships with trusted medical providers and improve the cultural responsiveness of the care their community members receive. So we can sit with that example for a little bit. Got a particular incident that came up for this UIO, and they have a few goals in mind. They want to make sure that they're referring their community members to places they're going to be respected, and they want to build those strong relationships. And we can go ahead and share, we'll have that shared in the chat so that we don't lose the context of the case study when we go back to the guide. We can sit with that for just a moment. In the chat. All right, since that is in the chat, I'm going to take us back to the guide now. Just moving right along. Here we go. So I'm out of presentation mode for the PDF. Now I'm just in the PDF itself. So I'm going to be scrolling through, and we can even click on these categories to go to where we want to be. So with this concern in mind, if you're this UIO, or maybe if this applies directly to you, where might you start if you wanted to make some changes? Feel free to use the chat. Feel free to come off of mute. A great place to start is kind of identifying one of these 6 categories that you'd like to dig into, maybe 1 or 2 or 3. And there are no wrong answers here. There's no wrong way to approach the question. I could pick someone to share their thoughts if no one has any strong feelings at the moment. And I will emphasize, just throwing some thoughts in the chat is always fine. If you just want to give me a broad category to start with, I can dig in from there. I know I have my own thoughts, but I'm not the one that does this work. It's all you. So really want to hear what is most salient for your organizations.
I can chime in. Carrie from Native American Lifelines Baltimore. So this is actually a part of the work that we do, and I'm thinking of a recent experience where I accompanied a patient to get care, and they have a very distinctive last name, and a lot of our traditional names refer to body parts or characteristics. And so the first thing they were asking is whether the person's name was their condition or their medical complaint. And then if I was the translator. So we were going to joke because we share a common Indigenous language, decided not to do that. But what we do as an organization, I sit on our city's HIV planning group. So I would always recommend that if your city, state has an HIV planning group or a Ryan White Council, get on it. That's the best place to advocate and to leverage connections. The other thing is visiting with providers and then offering to do an in-service, so that, you know, not just cultural competency, because I don't like that word, but, you know, what does cultural humility look like for them, and, you know, giving real concrete examples about what is acceptable behavior and what is not, because and then breaking down for them why it's important, because I think had I not accompanied this patient, they just wouldn't have gone back, because like if you can't get the simple stuff right, like being respectful about a name, you're not going to get the big things right.
Yeah, thank you so much for sharing that example. That's such a real and grounded thing that I'm sure happens to a lot of folks. And yeah, really appreciate those suggestions there. Yeah, that cultural competency term, that can feel really kind of patronizing almost a lot of the time. And you mentioned cultural humility. Here it's framed as cultural responsiveness. I feel like there's a lot of terms that could be interchangeable there. And I think that could be a great place to start. Like if folks are looking at using this guide as a way to address this particular concern. You mentioned getting involved in some places where folks are really building those partnerships and advocating. And I think there are some great suggestions throughout here with cultural responsiveness. And again, it's there's a lot there's a lot going on. I'm not going to say there's one particular answer here, but this is a great starting place. And a lot of it is going to depend on kind of the capacity of your facility. What exactly, like, where are your resources? What is your staff set up to do? Sometimes it may not be feasible to be the ones accompanying folks to clinic. That is a fantastic thing to do if you're able to. It may be challenging at times to reach out and do some of that direct education, really providing those resources of this is what's acceptable and this is what isn't. We have to start with the basics. There's nowhere to go from here. But especially if we're talking about these outreach and referral organizations, a lot of that community outreach is really built into the structure. So maybe some of these are a pretty feasible starting place. So this one starts with the goal of enhancing cultural and linguistic responsiveness of health services, speaking exactly to Carrie's example. And again, these may be a little kind of like big picture, a little non-specific in some ways, and you kind of have to bring your own context to what would this look like within my practice? How can I adapt this to what I do on a daily basis? So if you're looking at some objectives here, maybe engaging Indigenous people in designing and delivering health programming, including clinical and behavioral health services, that's absolutely a part of it. Or the other objective, improving Indigenous people's experiences with healthcare professionals and with the systems in which they work. I think that's very much what we were just speaking to there. When Carrie says, we're an outreach and referral, and I have an HIV research and care background, so it was less a lift than it may be for others. Yeah, that's very fair. I think there's a great lesson in there in leveraging the resources and the expertise that you do have. And that's something anyone can bring forward regardless of that background, but it's really phenomenal to bring that to this space. So there's a lot of strategies here around really expanding the type of health programming that's being offered, training healthcare professionals, expanding curricula. There's a lot of that kind of educational, like medical provider training that goes into this. And is absolutely a key piece. Increasing awareness that relationships are at the core of care and healing across healthcare and social services. I know a lot of times Western medical institutions treat people as like full, just exclusively individuals, exclusively here for the singular medical complaint, and really broadening to that more holistic approach, bringing that syndemic idea into the organizations that you're interfacing with can be a really powerful thing. Any other thoughts? I can linger here on cultural responsiveness or go back to the table of contents and see if there's another area that might work for this particular concern too. And I really do encourage people to just read along on your own, find what's useful for you. If you have some thoughts, always feel free to share, whether it's in the chat or coming off of mute. I'm going to go back to that table of contents because I think there's one other area that could be really important here. All of them are applicable, but the piece relating to partnerships really stands out to me. There's some organizations I've spoken to who are really focused on that partnership building piece. They want to be able to refer people out for care, but they don't know too much about the clinics that they're interacting with. So partnerships could be a great place to start too. And getting right into, there's two pieces here, having read through the guide a few times. This first goal is strengthening partnerships within and across Indigenous communities to improve systems of care for Indigenous people. So maybe there's a nearby UIO, a nearby tribal health system, nearby IHS clinic. Maybe there's some partnerships to build there in places where you know that respect and that trust is already pretty foundational. For this particular example, it moves a little bit more towards the next goal, which is strengthening partnerships between Indigenous communities and public and private entities to improve systems of care for Indigenous people. So again, it's building those partnerships with, maybe there are outside clinics who really do have that full suite of care. They're able to offer a lot more services. And you just want to make sure that you have those working relationships and they have the knowledge and expertise to be respectful, to have that cultural humility in caring for your patients. So this is talking about creating partnerships between Indigenous communities and public and private entities and developing mechanisms to promote system-wide accountability and sustainability. I think that second piece can be really important after those partnerships are formed, is thinking about what does it look like to stay accountable to the goals that we're setting out here, to this foundational partnership that we have, and how do we make it sustainable going forward? How do we keep building? How do we respond if there's another incident like this? Those accountability and sustainability sort of pillars are the types of things that will keep this going, rather than just being, well, we tried to talk to them once, I thought we were doing okay, but things kind of fell off. I really like this strategy. It's 6-2-1, creating mutually agreed upon approaches to assess the strength of relationships, including processes for ongoing reflective evaluation. That is a really key piece. If that relationship and that partnership is strong and is foundationally built there, being able to have that mutual agreement on how exactly are we going to assess whether we're really accomplishing our goals here? Are we improving the care that our urban AIAN folks are able to access here? And that's really the heart of it all. So that's just one example of, I want to make sure we can move on to our other examples here. But this is exactly how I would encourage you to use the guide, is come in with a specific concern or question that you already have. It can be a little intimidating to tackle the guide as a like, oh, I want to find a way to improve our services. I think I'll just kind of try to find something. You absolutely can. I think that would take a lot of patience and time. So more power to you if you have that patience. But it could be really, really powerful to come in with, like, we have an example of something that we're really trying to work on right now. It's multifaceted, it's complicated, there's a lot going on, but maybe I can bring my scenario to this guide and zero in on what we can do to kind of approach it and overcome these challenges that we're seeing. So I am going to go back to our slides for our next little case study here. Here we go. That's number one. Now we're to number two with UIO B, which is a limited ambulatory clinic that does provide HIV testing. Clinic staff have recently been attending local health fairs and community events to offer mobile HIV testing, but they've encountered very little interest from community members. The clinic staff are seeking to increase the number of HIV tests they administer, both in clinic and at these community events. They're also looking to better understand why there's little interest in the tests they're offering. So we have kind of a different context here, maybe a little bit more towards the clinical services offering these tests, but people just aren't taking them up, whether it's in clinic or out at these events and fairs. So we'll get that posted in the chat as well, and I'll take us right back to the guide. There, moving right back up. Here we go. So again, we've got a UIO that does offer some HIV testing services, maybe not the full comprehensive HIV care, but testing is something they're really expanding into, and having some trouble getting folks to uptake them on the offer for the tests. Any thoughts on where you might start to tackle this kind of problem? Any relatable examples? Is this something that you've faced at your organization?
I can share a little bit. I'm Justin from the Kansas City Indian Center. So we have not formally started testing yet, but we're basically getting ready to do testing for HIV, hepatitis C, and syphilis. And I'm kind of anticipating that we'll, encounter some stigma and some resistance, and people like, well, why do I need to do that? And yeah, so I'm kind of curious about, strategies to address that, but also, not be just kind of like, really forceful towards people about it either,
Yeah, thank you so much for sharing. Yeah, that I think the key word that's coming out of that for me is that stigma, and especially when you have this background of knowledge, you're there with the resources and the urge to be a little forceful with like, oh, it's here, like, please, like, we can provide this service to you. Why isn't anyone taking it? Yeah, that's a fundamental challenge in this work across the board, I think. I think a great place to start really is that awareness and stigma piece. I think there's some great guidance within here on addressing stigma in multiple places. I think the primary area where stigma comes up in this example might be stigma within the community itself. Your organization is there providing the service. You've got well-trained staff. You're all there on the ground. But maybe it's the folks in the community saying, I don't really think that's for me. I don't think I need an HIV test. I'm not sure why we're being asked about this. And we do have yes, from Carrie, National Native HIV/AIDS Awareness Day can be a great starting off point to begin the conversation in community and destigmatize. We've been successful in partnering with the Baltimore City Health Department and hosted a round dance, get tested, get a free Navajo taco, win, win, win. I love that. There's one of these, and again, there's so many strategies, but one in particular is really focused on incentives. That's a big piece of it. Oh, goodness. This is where there's just so much embedded in here that I might not be able to find it. That may actually be embedded under the clinical resources piece, like how to get folks to use clinical services, which is the next piece I was going to go into. But absolutely, that like combining it with other things is a example that's kind of embedded throughout here. Justin, did you have something else to add?
No, I just wanted to mention that we're doing COVID and flu vaccines right now, and incentives are very effective. So it's just, you have to look at where does the money, like we got a special grant for the incentives in this case, isn't, we can't incentivize everything all the time. So
definitely. Yeah. Finding those incentives that'll work. It can even be small things, and that combination with other community events, with other practices. I think even just the idea of going to these fairs and events in general makes it so that it's not you are coming to this particular place only for HIV testing. This is standalone testing, and that is what you're here for. But kind of offering this service as like, this is part of whether it's, a health fair and there's other health activities going on, or more of a cultural community event. And it's just kind of woven in there as part of what's normal to have at a celebration like this. So I love Carrie's example there. Partnering with the health department, hosting an event around it, providing some incentives. I think those are all excellent pieces. There's a lot of great goals and strategies here around, we gave out pins with beaded dildos on them that read, keep it traditional. We still get asked to have those. I think that's great, having some fun with it. That's something that came out to the conference I was able to attend earlier this year. In a room with a lot of Native folks saying like, hey, the elders love to talk about sex. Like it may be there's some discomfort, there's some stigma, but like in a lot of places that can really kind of get the conversation going. And I love that. I think that's fantastic. So I think there's a piece of this that's always kind of balancing taking HIV seriously, taking STIs seriously, but bringing in just that human kind of like fun, energetic element of like, hey, this is all part of life. Like it's serious. We're not downplaying the seriousness of this. And we can talk about it as just, it's another thing that we all are kind of thinking about and dealing with when it comes to sexual health. So there's a lot of great strategies here around getting sexual health education materials into things like schools and other local community places. There's a lot of things about developing kind of community outreach materials. I know we've been able to produce some kind of animated videos that have some great information and sort of open up the conversation. So again, kind of depending on where, like Justin was mentioning, where your funding might be best supported or where the expertise of your staff can go, there's a lot of different directions to think about addressing that stigma. And there's another piece too. I mentioned the clinical resources. I don't need to get too specific there because there is a lot of information. Anything clinical, I recommend kind of doing a deep dive there. But if you're really seeking to understand where the stigma, where the hesitation is coming from within your community, data systems and research is a big part of that. It's kind of often overlooked. And again, this might be a capacity question. It might be another partnerships conversation to partner with organizations that do have this capacity. Starting to see how it's all kind of woven together here. But thinking about being able to gather your own data from your community about what would you do if you're offered an HIV test? What might hold you back from wanting to get tested for HIV? And maybe it's a little bit more in that qualitative realm. Maybe it's really bringing in some Indigenous-led data collection, some community-based participation. That's really highlighted here under 13.2.2 to strengthen that culturally responsive information gathering. That in and of itself can be a big part of the process. In really grounding your understanding of the community's why for not using something in the community itself. Hugely important and is really highlighted through the data piece. I know data can be kind of sticky and big picture and a little overwhelming if it's not something you typically work in. And there's a lot of great resources here that point to ways to get that information to further that understanding. Great. I know we're getting close to time, so I want to move on to our third little case study here, but I really appreciate the examples both in the chat, off of mic. I love this conversation. And if you can't tell, this is some of my favorite stuff to talk about. So I'm really glad you're all able to join us today. And we will move back to our presentation and move on to case study 3. So now we have a UIOC, that's a full ambulatory clinic that provides comprehensive HIV services, including testing, treatment, and prevention counseling, alongside traditional healing. UIO leadership would like to continue improving the availability and accessibility of their services, but the lack of Indigenous health data available regarding the HIV syndemic has made it difficult to fill their knowledge gaps. UIOC's leaders would like to increase the amount and quality of culturally responsive data that informs their HIV service provision. Program evaluation and reporting measures that are culturally grounded are of particular interest to them. So we've got a different type of concern here. Again, it's in that data systems piece. I already kind of hinted to it and alluded to it there. But the gaps in knowledge, the gaps in existing data, and really wanting to find those evidence-based practices that are going to push them forward is of interest to this particular UIO. So let's go back to the guide. We've got that in the chat there. There we are. We can head back to our table of contents up at the top here. And again, this is a pretty particular scenario. You know, it's a large clinic. They offer a lot of services, and their main concern is kind of bolstering the programs with evidence-based practices and filling their knowledge gaps. This type of concern could apply even if you're a smaller clinic. Maybe you're outreach and referral and you do just really want to understand the needs of the community. Maybe you provide some testing and some services, you refer out for treatment, but you would really like that depth of understanding. You don't even necessarily have access to data on community HIV rates and things like that. So these types of concerns could apply at a lot of different levels. Just one particular example where it may be a larger clinic. So with our last few minutes here, any thoughts on where you might start with this particular question, trying to fill those knowledge gaps, get some kind of culturally grounded data and information? I did kind of give this one away a little bit. It is very data systems driven for sure. Before digging into that for just a minute or two, I do want to highlight the promising programs and practices is a great place to start. See what other organizations are doing. You know, maybe if you're particularly focused on that clinical piece, seeing what these other orgs have accomplished. Maybe youth is a particular focus for you. Look at what your youth programs within this community, within this larger community are doing, where they've found success. And again, I would encourage, it's not just, you don't just have to refer to what they've done with their program. It could be reaching out and building a relationship and a partnership with that organization, learn from their successes and their challenges, see how it might apply to you. So there's a lot there. If you're really looking for that evidence-based practice or those promising programs, there's a lot linked to here. And then you can always go right up to the data section as well to think about, again, there's a lot of different ways to apply data concerns. There's research and evaluation to improve. There's strengthening data systems and data sharing processes. So maybe if you don't have the capacity to do a lot of independent research, a lot of data collection on your own, what can you do to start sharing that data a little more cohesively with either other clinics in your area or other Native-led organizations, whether it's other UIOs or local tribal organizations? There's a lot of suggestions here for enhancing that information sharing and strengthening the culturally responsive information gathering. So some of that is reaching out to others, seeing what they're doing, seeing what you can build on together, or even developing measures internally. So that's kind of our last case study. I know we're getting close to time, so I'm going to go back to our slides and close out for today. But before I do want to emphasize a big thing I would love to come out of this is for you all to know that we are here to provide one-on-one direct technical assistance for exactly these types of questions and concerns. This Indigi-HAS guide is a great starting place that we could use together. Bring your concerns to us. We can start clicking through. We can bring in other programs that we're aware of that aren't housed here, and just talk through what specifically it is that you need help with, identify some strategies, identify some things that we can work on together. That is what we're here for. So if this felt useful for you, which I hope that it did, please come to us with those questions and concerns. Request TA, that technical assistance piece with us through the link that was just posted in the chat, and we are more than happy to do this for you. It's a service we provide. It's one of our favorite parts of the job. I'm going to go back to our slides to close us out. And there we are. I want to say thank you so much for attending. We had some great comments and input from everyone, and I really appreciate the attendance today. I know this is an area that's really close to a lot of our hearts. So really thinking through these practical applications. I hope you got something out of it today. And again, really appreciate everyone being here. And once again, we remind you that we appreciate any feedback you'd like to provide about your session experience. So please complete that survey. You can use your phone to scan this QR code or click the link that's going to be placed in the chat box. We do really appreciate it. We're always looking for ways to improve these sessions so they're tailored to exactly what you need.